of the practice settings that massage therapists are going to see medically fragile clients are going to be mainly in hospital settings or institutionalized care. They might see a few in private practice, but most of all they'll be in either their home, which will be the client's home, in private residence, or in hospitals. So those are the two main settings, and both of those settings require completely different set of criteria. So for instance, when you go into a client's home, you are not going to be bringing your massage table, you're not going to be bringing your massage chair, you're not going to be massaging them on the floor. You usually are going to massage them. This is also true, I say completely different, it's not entirely true, because one of the similarities between the two is you're going to massage clients where they are. And typically they're going to be in their bed, they're going to be in a recliner, or they're going to be in a wheelchair. So you have to be able to modify the session from a positional standpoint, the therapist position standpoint for those settings. And it might be kneeling on the floor, which you'll need a knee pad. It might be sitting in a chair on a client, or if they're in the home, typically they're going to have a hospital bed, even in a home. So you can raise or lower that bed, but the important thing for the therapist positioning is to keep their spine erect. Usually, and when you're in a private practice and your office, you're going to be leaning over the massage table. That isn't the case here. Nice straight back, and you're going to adjust the client accordingly. Now, if you have a bed rail between yourself and your client, you're going to lower that bed rail. And the technique that you're going to be doing is also going to be a little bit different. We'll go into that in a few minutes. But when you go into a hospital setting, it's very different in that when you go to the unit or on the floor, you're going to talk to the patient care coordinator first. This is more hospital-based massage. Find out what their directives are, and then you're going to go to the patient's room, the client's room. And we teach that it's very important to pay attention to the notification signs that are on the door. It may be something like NPO, which means nothing by mouth. It may be contact precautions, which means anything that you're going to be directly in contact with the patient, in this case. You might need to glove up. You might need to put a gown on. You definitely need to wash your hands before and after you do client care, just as you would in a private practice setting or in a residential setting. You have to be concerned about, is it a private room or a semi-private room? You have to be sure, and when you go into a room, if there's another patient in the room, to draw the curtain between. Be sure to introduce yourself before you start, of course. But let them know why you're there, and to allow for some privacy, pull that curtain, do your massage, and when you're done, pull the curtain back. When you enter a room, and if there are team members there, hospital team members there, or family visitors or family friends, you want to acknowledge them. Again, introduce yourself, state why you're there, and then be able to massage in a busy room. In the class that we did at the AMTA National Convention, we also talked about ways to negotiate or negotiate these decisions with the caregivers or with the team members that come in. You know, should I massage in a busy room? Should I leave? All those considerations. We also talk about when you enter a room and there's a curtain already drawn, that usually means a team member is there performing some kind of service that requires some privacy. In that case, it's better to wait outside the room. And then when the curtains reopen, then you can have your conversation with your client. So there's just so many considerations to think about whenever you're doing the medically fragile client. One of the key things I like to talk about whenever you're working with the medically fragile clients in terms of pressure and technique is to use a patterned sequence. And I particularly am fond of a sequence that was developed by Dr. Jane Buckle, who was a nurse, PhD nurse in London, England. And she advocates for something called the M technique. And the M technique has a protocol in which everything remains the same. You use the same pressure, the same speed, and the same sequence for every client, every massage. And what I like about this technique is that it is very reproducible and therefore useful in research. So we can use this as a way to document massage outcomes for patients, in this case medically fragile patients. And so going back to the number 3, so when you think about, we'll talk about pressure first. If 0 on a scale from 1 to 10, if 0 means no pressure at all, and 10 means crushing pressure, you want to stay at about a 3. And this is the client's or patient's 3, not your 3. And so the pattern sequence is everything is done in threes. So when you do one stroke, you do it 3 times. And the rationale for this is that when you first do it, it's new or novel. And so the client goes, oh, this is something new. And then the second time you do it, it's recognizable. So there's the client understands, oh, what's going to happen. And by the third time you do it, they're able to relax because they understand the pattern. And the pattern becomes almost the mantra in which not only the person receiving the massage becomes relaxed, but the person giving the massage becomes relaxed. And it was so fun for me as a teacher when I taught this at the National Convention to watch the therapist and the teams relax, both the receiver and the giver, and it got better over time. So what we did in the class was we did one side and then the other side, and then by the time we traded, the techniques got better, and I saw improvement within just a matter of 10 minutes or so. Going back to speed now, because there was the 3 things we talked about. So if 0 is not moving at all and 10 is moving very fast, you want to stay at about a 3. So what I'd like to do is to demonstrate that technique. So when you begin your massage, you want to think about the lubrication that you're using. Now what I'm going to be using for my demonstration with Karen is some good unscented lubricant, and I put it in a clean paper plate. But other things you might want to use an individual packet for a single-use client, or one of those little cups with a lid for a single-use client, or you might want, the hospital sometimes has little individual lotions that they can use for the client, or you can use what the client has in their room for personal use because they're familiar with it. The important thing though is to not bring a container that you have used with one patient, bring that out of the room and use it for another patient. So be sure that it's a single-use container for that particular client. So the way we're going to get started now, I'm going to take some lotion and I'm going to put it on my hands. Now I'm only going to be demonstrating the hand and the forearm. And our patient today, our subject, his name is Karen. And so I'm going to gently apply a little bit of lotion. The sequence for the hand and forearm are 9 parts. The first part is alternate hand stroking to the elbow. The second is lateral movements with the palm down. The third is joint circling. The fourth has 3 parts. The first is the scissor hold. The second is a pressure point right on the fingertip. And the third is stroking all the way down the finger from the wrist till the end of the digit. The 5th is turn the hand over. The 6th is little finger links. Seven is lateral movements, palm up. The 8th is turn the hand over into a handshake. And the 9th is one hand stroking from the wrist to the elbow. Once you finish the 9 sequence pieces, what Jane Buckle recommends is finishing with a kiss, which you stroke all the way down the arms and just traipse off the fingertips like this. Thank you.